In the past, dental implants were very difficult, and it took months of various dental procedures before you had a complete set of new teeth. Today, it can be done in one day with a procedure called All-on-4. We talked with Dr. Wayne Brueggen, who introduced this procedure to Houston.
What we do that's different is that we're able to take people with no teeth or they can't save the ones they've had, and in one day we can remove the teeth if that's necessary. We can place implants and build them a new set of teeth that don't come in or out, that look and function naturally. And we can do that in one day. The traditional way of doing dental implant surgery was to extract a tooth, let it heal for a few months, and then possibly do a little bone grafting and let that heal for a while, and then place an implant, and then a few months later build a tooth on top of it, and you went from missing one tooth in about a year, maybe 18 months, to having a new tooth. And if we were going to replace a full set of missing teeth, it was even more complicated because the necessity for having more bone was greater. We had to do sinus surgeries, a lot of things of that nature. But I did it that way for years, and it was wonderful. It took people who, they were hopeless. They had no teeth, and it gave them their lives back. It just took so long to do it. I just was always looking for better ways. And there's a gentleman named Paulo Malo. He's an oral surgeon. He's from Lisbon, Portugal. And I decided that I would go hear him speak, so I did. And after his lecture, I went up to him and I told him that, this is very intriguing. If I have to learn how to do this, will you teach me? He said, well, of course I will. You've come to Lisbon and I'll teach you. And so ultimately I ended up in Lisbon a few weeks later, and all we did from daylight to dark, literally from 6 in the morning to sometimes 10 at night, 6 days a week, were what we call all-on-4 cases. Those are the cases where we place the implants and build a new set of teeth in the same day. And I got to assist him in his surgeries and work with his patients who had already had it done, who were returning, and see what it was like for them, some of them a week later, some of them years later. And it was amazing. It was an awesome procedure. Being an implantologist already and having had a great deal of training and experience placing implants, it was easy. There wasn't much different about the placement of the implant. The difference is the protocol of placing the implants, putting the entire system together where you have surgical assistants who can help you, and you have laboratories in your office who can do the prosthetic part for you. Just bringing the whole team together in one unit is what makes it really possible. There's a terrible stigma to folks with missing teeth or terrible smiles with just one missing here or there and the rest of them bad. So it restores people's ability to socially become active again, restores their self-confidence and their self-esteem, and it gets people back on track for their careers. I had a model who came to see me who had lost all of her teeth because she had some gastric reflux from a surgery that she had. And of course, she couldn't model at all anymore. And she had the procedure done, and 2 weeks later, she was on the cover of Supermodel magazine. She was her cover girl, 2 weeks after she had had the surgery. So you can just imagine how it changed her life. And the effect that it has on most people, even many men, is they get a tear in their eye and they're just astonished. And the amazing thing is I do it every day, and I've been doing it for a long time. And it still affects me the same way.